Marijuana, which is also known as cannabis sativa, that's the botanical name, contains over 500 compounds. Two of the most familiar compounds are tetrahydrocannabinol, also known as THC. This is the chemical in marijuana that gets you high, and it does so by interacting with what they call endocannabinoid receptors in the brain. But I'm not going to talk about THC today. That's another topic. I've written about this, the effects of marijuana on bodybuilding and fitness and all that, but I'm not going to talk about that today. Today I'm going to talk about another major element actually found in hemp, the hemp plant, which is called I want to pronounce it properly, cannabidiol. Cannabidiol. It's also known as CBD or CBD oil. So here on, I'm going to refer to it as CBD or CBD oil. It was discovered in 1940, and it's like I say, it's a compound derived from hemp, and it's marketed as the reason I'm talking about it today, it's actually marketed as a kind of a commercial supplement, and I'll tell you the reasons in a minute why it would be marketed in that way, but you should know that it was never approved by the FDA or the Food and Drug Administration of the United States. They don't consider it a supplement, and they don't consider it legal to sell. So theoretically, when you buy CBD or CBD oil, you're buying an illegal substance, but the chances of being thrown in jail for that are very unlikely. I did it myself. I'll get to that in a minute. Why I bought CBD oil, I'll explain that. There is some science behind the use of CBD. For example, it can reduce the frequency of certain types of seizures, especially certain types of genetic seizures in children. There's two of them in particular that CBD oil is pretty effective, and as a result of that, recently the FDA actually granted approval of a CBD-based drug to treat these childhood seizures. I'll talk about that also. It may also help alleviate anxiety and schizophrenic symptoms, especially psychosis, which is getting more and more prevalent today, unfortunately. Using CBD for this purpose involves ingesting hundreds of milligrams daily, much more than you would ever take in a supplement. So in that respect, when you're treating these type of conditions, CBD acts more like a drug than any type of natural supplement. You should also know that less than 20% of CBD is orally absorbed. Just like a lot of other natural compounds, you only absorb a small amount. In this case, about 19 to 20% of oral CBD, cannabidiol, is absorbed. CBD is what they call a cannabinoid. It's found in both hemp and cannabis. Cannabis, of course, is the plant that produces marijuana. Hemp is another plant, which is also known as marijuana, as I said. But unlike the psychoactive compound THC found in marijuana, cannabidiol does not affect perception or behavior. In other words, it doesn't make you high like THC. It has no psychoactive effects. It's been successfully used in treating various types of seizures at doses of 20 milligrams per kilogram of body weight, far more than is suggested for the normal use of CBD. These higher doses do produce a number of side effects. One of the suggested mechanisms of why CBD exerts its effects in the brain is because it inhibits a compound called fatty acid hydrolase. Fatty acid hydrolase, and when you do that, you increase the amount of these natural substances called endocannabinoids. They were discovered in 1980, and they're basically the body's own form of marijuana. They're called endocannabinoids, and they interact with endocannabinoid receptors. There's two types of endocannabinoid receptors. Endocannabinoid receptor 1 is mainly involved with inflammation, and the other one is, I don't recall at the moment what the other one does, actually. I know that the CBD has a half-life of 9 hours. In other words, half the initial dose that you ingest or whatever way you take it is broken down in 9 hours. That's called the half-life, half the initial dose. The side effects of taking too much can include severe diarrhea and vomiting. Some studies show that CBD works better than drugs used to treat epilepsy. It does this by modifying the release of certain neurotransmitters in the brain, particularly one called GABA, which is the main inhibitory neurotransmitter of the brain. A lot of the anti-seizure drugs work on the same pathway, but in some ways CBD is actually more potent than the actual drugs. As I said, other studies show that CBD, cannabidiol, can reduce psychiatric symptoms. One study showed that ingesting 400 milligrams of CBD reduced anxiety in young men in an hour, and when it was ingested an hour after. Let me backtrack. A study showed that young men who ingested 400 milligrams of CBD showed notably reduced anxiety an hour after they ingested the CBD. It also produced, unfortunately, a little bit of sedation. In other words, it made them feel tired. Maybe they want to take a nap or something like that. Another study showed that ingesting 600 milligrams of CBD significantly reduced the anxiety associated with public speaking if ingested 90 minutes prior to speaking. Speaking in public is one of the most anxiety-provoking behaviors known. And if you take CBD, a dose of about 600 milligrams, it'll actually relax you enough where you will be able to speak more efficiently in public. In regards to sleep, a lot of people take CBD to help them sleep. In fact, that's when CBD was first suggested to me by another guy in the gym, because I mentioned that I have insomnia. He told me that he tried CBD oil, and it worked like nothing he's ever tried. It put him to sleep in about 20 minutes. But CBD has been suggested as a sleep-inducing aid, but at low doses, such as 15 milligrams, it produces a stimulating effect. In other words, it'll actually forestall sleep onset if you take it in small doses. A 2017 study found that when 15 men and women with insomnia ingested 160 milligrams of CBD a half hour prior to bed, it increased sleep duration, but it did not cause them to fall asleep faster. Lower doses of CBD did not affect sleep at all. However, in another study of people who did not have insomnia, providing 300 milligrams of CBD 30 minutes prior to sleep had no effect in the time it took them to fall asleep, nor did it affect any other measure of sleep quality. So it's kind of iffy about CBD stimulating sleep. One interesting effect of CBD, though, is that a 2015 study showed that CBD oil reduced addictive use of marijuana. There's these people that just can't they can't stop smoking or whatever using marijuana. CBD oil will help modify the craving for marijuana, and it also reduces the craving for nicotine and opiates. So that's a pretty good effect there, CBD oil. Topical forms of CBD are often used to reduce pain and inflammation. In other words, if you put CBD like in a lotion or something that you put on your skin, it'll reduce muscle and joint pain pretty effectively. CBD is better absorbed through the skin than its THC from marijuana. Animal studies do show pain reduction from topical CBD application, but no human studies have confirmed this. It's only in animals. However, I've seen anecdotal stuff written by people on the internet where people engage in training or athletics. They've had sore joints, sore muscles. When they apply CBD oil, they claim it brings them a considerable amount of relief. But that, again, is what they call anecdotal information. It's not scientifically backed because there's no actual human studies on it. A recent study from Cornell University found that providing 2 milligrams per kilogram of body weight in older dogs with arthritis as 2 daily doses greatly reduced pain and increased mobility in the dogs. The dose would amount to about 18 milligrams in the morning and 18 milligrams at night for a 20-pound dog. Another study, who was this? The FDA, I can't even understand my own writing. The FDA has approved a prescription. Oh, I was talking about it before, where the FDA recently actually approved a drug to treat seizures that's actually CBD. It's an oral solution of CBD, and it's called Epidiolex. And again, it's used to treat seizures. It was approved last June. CBD supplements cannot be sold as dietary supplement legally in the U.S., but it's easy to obtain it online, as I said earlier. One problem with CBD supplements is that the content of CBD in the supplement, the actual amount of CBD varies widely. This, again, is a problem with the supplement industry, with herbal supplements. A lot of times you're not getting the dose that's listed on the label, you're not getting the actual dose. And this is a big problem with CBT also. The content of CBD in the supplements varies very widely. A 2017 study showed that 7 out of 10 CBD products don't contain the listed amounts of CBD. 45% of CBD products contain too little CBD, and 26% of CBD products contain too much. So again, CBD, real problem with the whether you're getting the real stuff. Hemp oil, which is often sold as a natural source of CBD, is not a true source because it's made from hemp seeds, which contain very little CBD. They usually contain less than 1 milligram per serving of CBD. CBD is found in the flowers and leaves of the hemp plant. Most CBD oil products are made from hemp seed oil with an added extract of CBD from the hemp flowers. There is also a dangerous synthetic form of CBD called 4-CCB that can cause a number of serious side effects such as seizures, shaking, confusion, and hallucinations. This happened in Utah, where the synthetic version was sold in 2017 and this year, 2018. These were products listed as CBD oil, but actually contain no actual CBD oil, only the toxic synthetic version. Symptoms began 30 minutes after ingestion. Interestingly, CBD can inhibit certain enzymes in the liver that work to degrade ingested oral drugs. Thus far, this effect has not been seen in uses of commercial CBD products because the products usually don't contain enough CBD to affect the liver enzymes. Some of the drugs involved that can be affected by CBD include certain antibiotics, Viagra, antihistamines, statins, beta blockers, antidepressants, and testosterone. But again, you have to ingest a lot of CBD oil to affect the liver metabolizing of testosterone, so it's nothing to really worry about. Theoretically, CBD products that contain larger amounts of CBD could contain enough THC to produce a positive drug test for marijuana. This, however, is more likely to occur after ingesting hemp seeds or oil rather than straight CBD supplements. Because of the slight possibility of contamination of CBD by THC, CBD is banned for use by the World Drug Association. In other words, they consider, because of the possibility of the presence of THC in CBD oil supplements are banned in athletic competition. A 2013 review of CBD showed it may help prevent the spread of cancer and also suppress tumor growth. This, however, is a preliminary study that needs further confirmation. A 2014 study found that CBD lowers sebum production. Sebum is kind of an oil fatty substance produced in your skin, and when it tends to clog up in the pores, it causes acne when it's acted upon by P. acnes bacteria that reside on the surface of the skin. By lowering sebum production in the skin, CBD oil might help prevent acne. So that's another possible use. A 2014 mouse study found that CBD may help prevent Alzheimer's disease-related memory deficits. Again, this, however, was a mouse study, and so it needs human confirmation. So there's some pretty good evidence that CBD oil, to sum it up, it's probably pretty good for. Again, most people don't have seizures, but it's useful for that, especially certain childhood forms. It's very useful for anxiety. It seems to have a relaxing effect. When used topically, it seems to have an analgesic effect to reduce pain, let's say muscle or joint pain, if it's used topically. I actually purchased CBD oil last year. Some of you who watched some of my past videos might remember the dog barking in the background. That was Chip. Very sadly, Chip got a form of cancer, and I did everything I could to try and treat it. I spent a lot of money on vets, and I used a couple of natural remedies. Among the things I sent for was a hemp extract that contained in each dosage 15 milligrams of CBD oil, because I was hoping that it would help stop the spread of cancer, of his cancer. Unfortunately, the cancer had metastasized or spread to the extent where it was untreatable. So, unfortunately, Chip passed away, and I still have this is what I purchased for him. This is This is a hemp extract 1000 it's called, and it comes in an applicator. I'll just show it to you. It comes in an applicator. You just see if you could see it. You basically pull back. It's like a spring mechanism. You pull it back, and the CBD oil comes out of here. And each application provides 15 milligrams of CBD oil. This I sent for this particular brand because it's been analyzed and it's shown that it actually contains pure CBD oil. I should warn you though that in case you're thinking of buying it, this little tube, you can see it's just a small tube. This cost $129, and I only used it twice. I used it once on Chip, and I used once myself to try and help me sleep, which I wasn't aware at the time that 15 milligrams actually acts as a brain stimulant. So, needless to say, it didn't help me sleep. But that's about it for CBD oil, also known as cannabidiol. If you want further information about nutrition, exercise science, anti-aging research, fat loss techniques that really work, women's health, hormonal therapy, subscribe today to my Applied Metabolics newsletter, www.appliedmetabolics.com. 40 to 50 pages every month. It's more like a monthly ebook than a newsletter. It's all evidence-based, no BS, no advertisements, not trying to sell you anything but information. Anyone who subscribes gets an invitation to join my private Applied Metabolics Facebook page, where every day I put new information on nutrition, exercise science, general health, and medicine. Also, I have an email portal on the Applied Metabolics site where I will answer questions only submitted by subscribers. I don't answer unsolicited questions. And that's about it for today. If you want to have the best friend you ever have, go to your local shelter, adopt a dog. Right now, I have my Bruno dog, my little senior citizen. Always try to get him in the videos. Every time I do these videos, he seems to know about it, and he hides under the bed. I can't get him. One of these days, I'll try and bring him in another video. I really miss Chip. He was like the best little friend anybody can have. That's why I really think that you should consider adopting a dog from a shelter. Take care. Thanks for listening.